Hey everyone, it's Dr. Hodges, and I want to give everyone a little quick tutorial on how to use and draw up medicine in an insulin syringe. Typically, when you receive medication from a compounding pharmacy or any pharmacy for that matter, and you're given a syringe, the insulin syringes that we use, they are 1 ml, so 1 ml, and that corresponds to 100 units. So you can see on this syringe, it's labeled 10, 20, 30, 40, all the way down to 100. Typically, the pharmacy that will mail you the medication will have the insulin syringes included. If you run out or you need to get more, you can always go to your local pharmacy, but you can also order these online. They are sterile. You can get these from Amazon. And what you're going to Google or search for on Amazon would be 1 ml insulin syringes. And what's nice is that they usually will come with the little needle already attached to them. So for a lot of my patients that are starting some of the medication, a lot of times you'll start with either 10 units or you'll start with 15 units. And this is what they're talking about. They're talking about drawing up the medication right here, right to where it says 10, okay? And then if you need to do 20, because the little hashtags are really small, you can always just go, my phone's focusing in and out. You can just go in between the 10 and the 20 and you'll be fine, okay? But typically, what I like to do is, let's say you have your medication, and this is just for display purposes. What I like about using this is old, it expired in 2020. This is old B12. What I like about it is it's red, so it's easier to see whenever I'm kind of doing a demonstration. What you'll want to do is take a little alcohol swab. Let me grab one. And little alcohol swab, you can buy them pre-made, or you can just get a cotton ball with some alcohol. You're gonna just wipe off the top. And then what I always do is make sure that the plunger, I pull back the plunger just a little bit, usually just past what you wanna draw up. And then you take your bottle and you turn it upside down, and then you boop, put it in the little diaphragm, and then what you want to do is push in air, because that will get out any vacuum, and then you begin to draw up the medicine. And then it takes forever because it's just drops, bloop, bloop. I always drop a whole bunch. And then, because you don't want air, you draw it, push it back up into where it says 10 units. Then you take it out, and now you are ready to inject. See, easy peasy. And these, of course, are just single-use syringes. Whenever you're done, you can put the little cap on and dispose of them in a sharps container. A lot of times you can pick up one of those sharps containers at CVS, you can order them online, and it just keeps all your sharps, that's like needles, anything with a blade, it just keeps them as a safe way to dispose of them. So, happy injecting. One other little side tip from Dr. Hodges that you can use is, if you actually pinch your skin, it kind of like, I pinch, whenever I've used medication, I'll pinch the skin, and keep on pinching while you put the needle in. You don't even feel the needle. So that kind of helps. One other thing that I could show you guys too is, these are the other 2 demos for the other weight loss medicines that are on the market. This one is Wegovy, and this one is Zepbound. If you are using Wegovy, what you do is you take the top off, and you see how there's a little window? Take the top off. I'm going to you can put it on your abdomen, your leg. There's all this stuff online that says, oh, you don't get nausea or whatever if you do it on your leg as opposed to your abdomen. Well, That's complete placebo effect. And I know that there's going to be people on the internet that will tell me, even though they're not doctors, that, oh no, it makes a difference. If it makes a difference for you, I don't care where you put it, but it's a sub-Q shot, so it doesn't matter. It's going to go systemically. But I'm just going to use my hand as a purpose. So this moves in and out. So what you'll do is you'll alcohol swab the area. And then I like to put if I'm putting it in my belly, I like to put it where I can see this little window, because that's when you know that the medicine is done. And so you put it in and you can see it deploying. And you take it out once it stops. It will click before it stops. Do not take it out as soon as it clicks. You have to watch this window and make sure it stopped moving. Otherwise, medicine will still go shooting out. Okay, so that's with Wegovy. This is Zepbound. What you do is you take the top off. You turn it from lock to unlock. And again, now this one, you deploy, you just press the button. And again, you'll see it moving. And you take it off when it stops. There you go. And now you take it out. So that's how you do it. So you can give yourself a shot with this. You can give yourself a shot with this. You give yourself a shot with this. If you are using manufacturer insulin, medication syringes like these are single dose pens, typically a 1 month supply. You will receive 4 of these per month, and you just throw them away after each use. So you only use these one time. If you are getting compounded medicine, you'll receive a bottle of medicine, and it is multi-use. And so you'll use this one bottle full of medicine multiple times. You just have to make sure you use a clean syringe every time. So this needle, like these, are all single use. So once you use this one time, you throw it away. But again, these are really inexpensive. If you run out of them, you need more, you can get them from Walmart. You can get them off of Amazon. I'm sure there's lots of places, and you can get, and they'll be sterile. So I hope that this has helped you guys. Happy injecting.